Hi, everybody. My name's Dr. Schnorr, and I know we just did a Facebook Live, and I think there were some unanswered questions, and I just wanted to answer those questions, probably 10 questions that we'll be able to go through today. The first question was about male factor infertility. How can a man increase his sperm count? Sometimes a man can increase his sperm count if his environment is not optimum. What that means is make sure that you're not overweight. Make sure that you're exercising. Make sure that you're not using any male bodybuilding hormones. Primarily testosterone would be bad for sperm counts. Make sure alcohol consumption, if you have alcohol consumption, is moderate. That would be generally 10 or less glasses of alcohol per week. No tobacco use, no marijuana use. And so that would be the best thing to do. Diet, probably not much of a role for male factor infertility, and lots of nice studies on vitamin consumption, and vitamins don't improve male fertility. A second question was about ovulation. How would a woman know when she's ovulating? People do ovulate sometimes at different times. It's going to be more about your menstrual cycle history. Generally, you ovulate 14 days before your period. So if you generally have periods every 28 days apart, on the 14th day is when you would be ovulating. If your periods are 30 days apart, it'd be the 16th day of the cycle that you'd be ovulating. Some women, if they have questions about it, do ovulation predictor kits. It can be expensive and it can be stressful and often not helpful. I think the simple recommendation is just have regular intercourse every other day around that window of ovulation. And generally, if you're going to ovulate around the 14th day, having regular intercourse between day, say, 8 and day 16 to 18 would make sure there's adequate exposure to sperm when you're ovulating. So hopefully that helps you. What is there a special diet if you have endometriosis? No, there's not a special fertility diet. Many studies have been done on diet. We're probably, in our history as human species, the most nourished we've ever been. And so there's no belief that a diet is necessary other than weight reduction. Real nice studies on lowering body weight is helpful. And so I would strongly recommend that you try to get your body mass index less than 30 if you can. Make sure it's probably greater than 19 to 20 just for optimum fertility. Question, only one of my fallopian tubes work, and the only thing is DHEA is high. What do you suggest? If you have only one fallopian tube, the question would be, why is it not working? Often there can be scar tissue within the fallopian tube. Generally, if there's scar tissue in one tube, even if the other one's open, there's generally some scar tissue in the other tube. We call that tubal factor infertility. If you were to conceive on your own or conceive an IUI, the pregnancy rate typically would be lower and the ectopic pregnancy rate typically higher. Most people would recommend, including me, IVF would be the best way to bypass that and to fix any fallopian tube problems. Another question is, do you have a chance of getting pregnant with 2/3 of the fallopian tubes, meaning I guess a shortened fallopian tube after surgery? And if the tubes are shorter, they don't tend to work as well. And that again would be a form of tubal factor infertility, kind of better treated with in vitro fertilization. Another one is, I'm almost 40 years of age. How many months do you recommend that I try naturally? I say if there's no red flags, meaning you're having regular cycles and your husband's healthy and not on hormones and everything's pretty nice on your end, I wouldn't try for any longer than 6 months. If there's red flags like you're not having regular periods, maybe your husband's not healthy, maybe there's risk factors that your egg count could be lower than other women 40 years of age due to tobacco use, those are things that I would look at to try to see if you probably have a fertility problem and get tested and treated for that. So again, no longer than 6 months before seeing somebody, maybe sooner if there's red flags along the way. What are the chances after DNC to get pregnant? Well, your pregnancy rate should get back pretty normal after having a DNC. It depends on why you had the DNC. If the DNC was for a miscarriage, we generally recommend about a 1 month wait after a DNC for your hormones to come down to negative. And then once they're negative, then you can actually try to start getting pregnant right away. Some nice studies on this. If you get pregnant the month after you miscarry or 6 months later, they both have the same chance of miscarriage and same chance of birth defects. So that's good. Any recommendations for male factor infertility in regards to caffeine and alcohol? And I did discuss that earlier. We'll generally like 10 or less glasses of alcohol per week for a male, or probably 2 to 3 glasses of caffeine a day for a male, so as not to have an impact on the sperm count. So that would be the recommendation there. Let's see, another group of questions here. If you don't believe you're ovulating based on ovulation, you can predict your trips. How else can you tell and assess? And again, I think if you're having regular periods, you're generally ovulating. You're generally ovulating 14 days before your period. So just make sure you're having regular intercourse around that time of ovulation. You don't need to know exactly when you ovulate. A lot of people get kind of hung up on that. You just need to have intercourse every other day around that window of ovulation, remembering the sperm lives in the reproductive tract for about 6 days or so. So that would be the recommendation. And so that's the roundup of all the questions. I'm sorry that our sound went out halfway through. Don't really know what that was about. That was a Facebook problem, but we got this now. And if you have any questions, we're certainly here for you. We're at Coastal Fertility, which has 5 offices throughout the South Carolina, Southeast area. Our strong belief is that the laboratory is what gives the highest part of your pregnancy rates. And the reason our pregnancy rates are so high is we have a centralized laboratory, and we reach out to you with regional offices where you can be seen in your local hometown with one of our regional offices. Our offices are in Nexton, and we have an office in Lexington. We have an office in Myrtle Beach, and we have an office in Savannah, and then our main office is in Mount Pleasant. So it generally makes it so 95% of your visits can all be done in the same location, right where you live, with only needing to drive to Charleston once or twice for an IVF cycle to help maintain those high pregnancy rates. If you have questions, you can always reach out to us. Phone number 843-883-5800. And also remember the document that I discussed today, Optimizing Fertility, you can find at www.coastalfamilies.com, and then our website, www.coastalfertilityspecialist.com. Take care. Good to see everybody. Bye-bye.